So I'm Sarah Axford, I'm the Service Manager for Children First. So I've actually only worked for the organisation for 10 weeks, so don't make the questions too difficult for me. But just to say, Children First have a fantastic website and things like that, so please do go and have a look at that. And I have passed over to Simon some resources that you can look at in your kind of research and stuff, so we'll have a little look at those today as well. So, and there is a impact report that's just come out kind of in the last few weeks actually, so that's kind of talking about the last kind of year of our work and what we've done. So, does anybody know anything about Children First? Is it an organisation you've ever kind of come across or heard of, or yeah, some of you might.
Is this the one with the wee child like that?
No, I don't think so. It might be, I don't know. So the logo's got a little smiley face.
Alright.
So as an organisation, we've actually been going for 134 years. We haven't always been called Children First. We were called the Royal Society for the Prevention of Cruelty to Children. So does that make sense now? So I'll give you a bit of a sort of brief run over of the history. So in the sort of mid-1800s, believe it or not, there was no law against abusing children. You know, it wasn't against the law. Parents were allowed to, because children were their property, parents were basically allowed to do what they want. And believe it or not, there was actually laws against cruelty to animals before there was laws against cruelty to children. So the kind of movement of coming to think about offering more protection to children came about in America in the sort of probably 1870s really. And what happened was there was a kind of health visitor in a way, sort of somebody doing that kind of job, kind of went, and there was a young girl who was being kind of physically abused by her parents, her adoptive parents, and she found herself pretty powerless as to kind of anything. You know, the police couldn't help her, and because there was no law against, neglecting and, hitting your child, basically. So they ended up prosecuting these people through the laws that were there to protect animals. So they argued that animals, were, as humans, we were a kind of animal. So they used that law. So that's how the kind of, the protection to cruelty to children came about, really. So first set up in London in 1884. So that is what you know as the NSPCC now. And then Scotland was pretty much in the same year. So there was some 1889, it was kind of set up in Glasgow and Edinburgh. So yeah, that's kind of how we started as an organisation. But I suppose kind of in the 60s, and kind of what we did as an organisation was kind of go in, kind of prosecute people who were cruel to children. But that kind of responsibility went over to the kind of local authorities in the 60s, and that's kind of when we decided to change our name to Children First, because it was kind of a bit of a different focus, really. So, in the Borders, we have a couple of different services. So we've had an abuse and trauma recovery service for 40 years in the Borders. So that is working with children and young people who have been impacted by physical abuse, emotional abuse, sexual abuse, neglect, and the kind of impact of parental behaviour as well. So that's kind of looking at kind of parents who've got severe mental health problems or drug and alcohol addiction and things like that, and how that kind of, we work with children where there's been an impact to their lives. We also do some work around bereavement, complex bereavement, so children and young people whose parents have, there's been a kind of significant death or things like that. So it's it's pretty heavy work, but we've got a couple of staff, fantastic staff, who work with children in a really kind of therapeutic way, and they're not counsellors. They kind of come from a social work background, but do stuff with art, with play. We obviously work with really young children, so we've got a playroom and things like that, and we do kind of stuff in that way. And we work with, I think, you know, our kind of, you know, 4, 5, 6, 7, 8 years we can work with young people up to. And that goes up to 18. We also have a domestic abuse service as well. So we work with adults who are no longer at high risk of domestic abuse, but we also work with children where that impact of domestic abuse is really current, and sometimes they're still kind of living with perpetrators and things like that. So that's the kind of around the similar model around recovery and kind of trauma. Yeah, so that's us. That's the kind of Scottish Borders model. But across the country, it's all different stuff. So there's, you know, a lot of family support workers and things like that. We've got Parent Line, which is an advice line for parents experiencing difficulties with parenting, really. You know, kind of they're looking for advice around kind of parenting mental health or parenting, you know, other difficulties. We also run the Safeguarders panel. So that's local safeguarders across Scotland. And what I wanted to talk to you about today is kind of what we do to influence national policy around children's rights. So,
Can I just ask you a question? That's
Yeah.
really interesting. You're saying that there's these initiatives in the Borders, but nationally there might be different initiatives in different areas. What drives that? What, you know,
I suppose it's local need, really.
does it meet the local people?
Yeah, I think very much they evolve out of community needs. So, you know, trying to think, sort of in Edinburgh, they run some family support services. So that's real kind of, I suppose, going into families and you know, where there is kind of lots of complexity, you know, complex needs, where, you know, it's supporting with kind of parenting and trying to keep children in families, really. You know, kind of, you know, what our big belief is that children are better in safe, loving families. Yes.
So how long do they stay with you, or they just come like for one day and then
So we, with our abuse and trauma recovery work, we generally offer children and young people one-to-one sessions on a weekly basis. And that can last for however long they need us in their lives for, really.
Is it,
No, when you go Kelly.
are you like a charity?
Yes.
So it's no like, how is it? Not like a minimum.
like a social work kind of service
Aye.
thing?
Yeah.
More of a service,
Like a statutory, it's not a statutory service, but what our abuse and trauma recovery work is commissioned by the council. Does that make sense?
Aye.
So they pay us essentially to deliver a service.
Aye, like,
similar like to the day centers or something like that.
So our abuse and trauma recovery service sits within a model of support in the Borders. So a model of emotional health and well-being support. So that's in a kind of, I don't know whether you've ever seen it, I can pass that on. So there's a triangle. So at the bottom sits kind of universal services. So they're kind of stage 1 interventions where, you know, it's kind of like resilience work and, you know, kind of low-level mental health stuff.
what did you call that at the bottom?
Universal services. So something that any young person can kind of access for general emotional health and well-being support, basically. So I'm trying to think who's included in that kind of services. So things like, there's a new project called Stepping Stone Project, so that's kind of run out through kind of youth work services and things like that. at sort of the second tier, which is where we fit in, again, it's universal, so any young person can kind of access that, but it's a little bit more specialist. So the new Quarrier service, which is in the schools, that kind of comes in at that level. We're included in that. School nurses, things like that. So they're kind of, it's a bit more of a kind of longer term intervention, you know, a bit more kind of specialist. You know, they might work around kind of something like, you know, anxiety management or.
Is that about meeting a specific need, and that's what discriminates it from the low below, but it might
Yeah.
be,
Yeah, so we kind of fit into that, but we also, there's some tiers above that as well, so there's CAMS and children and family social work.
Explain what CAMS is, because I don't know if everybody knows what CAMS is. They might well do, but just in case you don't know.
So CAMS is the Child and Adolescent Mental Health Service. So in the Borders, varies across, every local area will have a child and adolescent mental health service. Will vary from area to area. So in the Borders, it's basically Andrew Lang unit in Selkirk. So they have psychologists, psychiatrists. They'll have kind of specialists, kind of things like autism support and ADHD support, and where there's a kind of diagnosis of mental health, basically. Yeah, so they're kind of that real specialist support, and there's quite long waiting lists and things for that, so, you know.
Are they at the top?
Not quite. At the top is inpatient care.
In or in?
Inpatient care, so that would be hospital care for kind of emotional, for quite serious kind of mental health issues, really. And that's not done in the Borders, that's done in Edinburgh.
So what's Huntley Burn and stuff?
Huntley Burn is for adults.
Oh, you're just talking about kids.
Yeah, talking about children and young people, yeah. So Huntley Burn is for adults, but if a young person requires inpatient care in the Borders, that goes to,
It's a similar place like that.
yeah, that goes, they unfortunately have to go up to Edinburgh.
That's really interesting, because it shows that